So glomerulonephritis is a very high yield topic. Without that, there is no paper. Then point mutation. Where do you see, doctor? Sickle cell and cystic fibrosis are the classical examples of point mutation. Okay, sickle cell and cystic fibrosis. Whenever point mutations occur, which point in the DNA structure is highly vulnerable to undergo point mutation is the question. There is an area where the cytosine guanine CPG island is a place which is highly vulnerable to the point mutations. Do you remember recent AIMS PGI November 2014 में single gene mutation disorder is which one was an MCQ? So examiner's favorite area is what are all the single gene disorders. Then proto-oncogene. Normally proto-oncogenes are good, we require because we need to grow. So it is required for growth and expression, found in normal cells, and typically it is induced by a virus and it will convert into an oncogene, and that is a mechanism of oncogenesis is what need to be remembered. What are the classical proto-oncogenes that you know? RAS, MIC, ERK, TRK, etc. MIC is important for Burkitt's lymphoma, as all of you know very well. Then coming to beta thalassemia, it's common in India because India is a tribe, and here we don't have chance of like Englishman can marry French girl can marry a Portuguese guy. यहाँ वो chance थोड़ा कम है, तो इसलिए best is in our village, in our street, next door is best, easy to capture the matrimony. So when there is a lot of intra-community breeding, right, then the genetic disorders perpetuate much higher, consanguinity, etc. So it's common in India. Then what is a normal composition? Can you give me the board? Alpha 2, beta 2 is the composition of the adult hemoglobin. Alpha 2, gamma 2 is the fetal hemoglobin. In beta thalassemia what happens? Beta is not well produced. To compensate that, more gamma is produced. That is the reason what will happen? HbF will be increased. But if it is alpha thalassemia, out of alpha 2, beta 2, alpha is not produced. Even for HbF also you require alpha. That is the reason how will be HbF in alpha thalassemia? Decreased or normal? Decreased in fact. Whereas HbF is increased in beta thalassemia. That is the fundamental difference when you do the electrophoresis between alpha and beta thalassemia is what you need to basically remember. And whenever thalassemia is there, we do repeated transfusions to treat the anemia, and all the transfusions will bring iron overload, and that lead to secondary hemochromatosis as a complication, as all of you know very well. So a similar question which can be asked in entrance is, if the hemoglobin F is present, then it is more likely to be beta thalassemia but not alpha thalassemia is what you need to answer. Then a question on mitochondrial inheritance. Once more, now you know uniparental disomy, Angelman syndrome, mitochondrial inheritance disorders. Favorite area for the examiner. So from where do we get mitochondria? From the cytoplasm. Who contributes cytoplasm? Egg. Not the sperm. Sperm only contributes the DNA, nucleus. So that is the reason only Amma can give mitochondrial inherited disorders, but not Papa can give, is what you need to remember. So mothers transmit their mitochondria to their sons and also daughters, but not both the parents. Then mitochondrial DNA में 37 genes are there. Any gene can undergo mutation. Mitochondrial disease commonly affects the neuromuscular system. May loss, mitochondrial encephalopathy, lactic acidosis and stroke-like episodes, neurological disorders. Because in the brain system require a lot of energy, ATP and mitochondria. Any deficiency of that will make the neurological tissue get affected the most. Okay, doctor. And recently there was one MCQ in the AIMS All India Calcutta, I don't know which exam it was. Why mitochondrial DNA is more vulnerable to undergo mutations than the nuclear DNA was one of the MCQs. I don't know which paper I discussed. So, but that is a very high yield topic for the examiner. So, another way of asking the same question in the tomorrow's entrance, they will give you a pedigree. In the pedigree, pura round wala cheese, dark colored things को transmit कर रहे, मगर square वाला daddy is unable to transmit the disease. Even daddy here has disease. Colored means disease. But all the children are normal if the daddy has disease. But mummy has disease. Round wala mummy face, which is most beautiful face after we are born to see. Instead of the square shaped daddy, who never bothered to. Of course, there are daddies who are very emotional and mummies who are completely callous. So, whatever it is. So, every time it is getting transmitted from that round wala mummy, then that become mitochondrial inheritance. That you have to carefully see. Similarly, you must practice how to identify a pedigree of AR, AD, XD, XR. All the 5 pedigrees today only identify. If vertically transmitting, what type of inheritance? If horizontally transmitting, what type of inheritance? If consanguinity is shown in the pedigree, what type of inheritance? Punch, inheritance pedigrees. One question will definitely come. Coming to the AFP level, it is raised in testicular tumor, raised in hepatocellular carcinoma, and there is a correlation between the recurrence and after the surgery. Hepatocellular carcinoma surgery karne ke baad it is supposed to fall down. If it is not falling and rising means there is a recurrence. And there is a correlation with the size of the hepatocellular carcinoma. But what is the upper limit of the alpha fetoprotein? Normal serum it will be less than 1. Upper limit is about 10. And any value above 200 is suggestive. And above 400 means definite. For the diagnosis of the hepatocellular carcinoma is what you need to remember. Examiner's favorite area is AFP. Maternal serum AFP level, if it is raised, what is your interpretation? Generally, there are 5 to 6 conditions. Omphalosin, hepatocellular carcinoma, neural tube defect. Then non-seminomatous germ cell tumors. Non-seminomatous germ cell tumors also AFP is elevated. Yolk sac tumors it is elevated. Ataxia, telangiectasia and some of the tumors. So don't worry, all this we will upload it into the newsformedico.com so that on mobile phone you can review. Then did he upload it into the download section? This today's question paper, PGI. Just find out if he uploaded, then we can ask our students to download it. Uploaded without encryption. Free download. I mean, after downloading, no need of calling us and asking what is the password. I mean, for some documents, you need to call us and ask the password because we want to listen from you. That's the whole idea. Lot of students in discussion forum will ask how to get password. Call the helpline. They will be more than happy to give you the password. Okay. Then of course, there are almost all 9,000 downloads within about past 2 weeks across the country. So knowledge is meant for free circulation only. So we will upload this paper we have uploaded. No key and explanations. That also we will upload, but you need password. We are tricky fellows. So carcinoembryonic antigen. It is used for monitoring the recurrence of the colon cancer. It is increased in smokers. It is increased in colonic cancer, but it is a non-specific indicator. There are many things where it is elevated. If your mood is not good also, it can be elevated. So, there is I am telling on a lighter vein. For you to remember, it is non-specific. It is non-specific is what you need to basically remember. Now, doctor, CA 125. Once more, 3 questions on, 4 questions on markers. So, you should carry a marker pen while preparing for PGI Chandigarh exam, doctor. So, CA 125 is a glycoprotein and it is increased in colon cancer. It is also a non-specific marker. Never commit for any marker that it is specific. Generally. Because there will be at least 2 to 3 other conditions where it will be elevated for most of the markers. Except anti-histone antibodies in drug-induced lupus. There are some specific markers, although you have to remember 8 to 10 specific markers are there. Then if you look at CA 125, about 1% of the normal females can have a level more than 35. Then if there is a post-menopausal woman, not pre-menopausal, and she has an asymptomatic pelvic mass, and if her AFP levels are found to be more than 65, then you should worry about a possibility of a malignancy. It has got a sensitivity of about 97%. So, post-menopausal may it is indicative, pre-menopausal may it is not much important to be worried about. So, that is the story of the first 50 questions. Right. Now, in sulfonamide allergy, what are all the drugs you should be careful to administer? What is your answer? Question number 53. Let us ask our online students, Kapil, Sanjay, Shailaja, Kiran, Shweta Reddy, A and E, acetazolamide. One more drug is there, you should recognize it. Our friend is saying C. C. Question number 53. Online students should punch. Prabha is proposing C. Very good. Bumetanide also. In fact, there is a very big list. I don't want to disappoint you. I don't ask you also to remember all that nasty stuff. But the list is thoda lamba hai. Anyway, you will recognize if at all the same question comes in future exams. Sulfonyl ureas को recognize करना आता ना? हाँ. But you should also remember cyclooxygenase inhibitors like celecoxib, rolicoxib, etc. Protease inhibitors में amprenavir is what you need to worry. Triptans. Also you should be careful if there is a sulfa allergy is a list which you need to fundamentally remember. Isoniazid is metabolized by what mechanism? It is by acetylation and it is first metabolized in the liver and excreted in the urine is what you have to basically remember. And if at all there is any renal failure, do you need to adjust the dosage? No, there is no need of adjusting the dosage. Which ATT drugs are bacteriostatic and bactericidal is one of the very, very routine questions asked in the PGI Chandigarh. So, rifampicin, isoniazid, streptomycin, pyrazinamide, they are all cidal. Cidal is killing. Rifampicin is Raja. Raja is known to kill. Right? Then, isoniazid also very powerful drug. Unless very compelling reasons are there, you can't eliminate the advantage of isoniazid in a TB patient. Streptomycin and pyrazinamide, all the 4. Ethametol thiazidazone is bacteriostatic and paraminosalicylate is also tuberculostatic is what you have to basically remember. Coming to the drug transport mechanism, let's talk about it. transport is energy dependent. That you all agree with me? ATP is involved. Most commonly, without need of ATP, only drugs transfer. So passive diffusion is most common method of drug transfer. Facilitated diffusion is what? A carrier will help to diffuse, and that also does not require energy. It uses somebody else's energy. Then pinocytosis is there. No? Pinocytosis means there is an invagination of the cell membrane and trapping which will basically occur. So pinocytic transfer is important for few drugs, very few drugs it is required. Which beta blocker has no alpha 1 antagonistic property? So what is the deal? Any PGI, any ends, any state PG, alpha blockers, beta blockers, alpha agonists, beta agonists, autonomic nervous system. And one question on cholinergic agonists, anticholinergics. इसके बिना क्वेश्चन पेपर ही नहीं है, तो you should remember atenolol, nebivolol, betaxolol, they don't have, but labetalol, carvedilol कैसे चीज है? Both alpha and also beta blockers is what you have to basically understand. What is an essential medicine? Basically WHO has given a definition of essential medicine basically. On that question was composed. It is costly but necessary, and it is needed for society, and it should be available at all times. It is not a drug listed in pharmacopoeia, nor it is an emergency drug. It is required for all at all times, like BP tablet. हर एक को चाहिए, insulin हर एक को चाहिए. Of course, insulin is also emergency medicine. So that's the point. What are the effects if you stimulate the adrenergic receptor? You all know cholinergic will stimulate the peristalsis and lead to diarrhea. Cholinergic. Opposite should be there for adrenergic. Adrenergic stimulation should not cause diarrhea, it should cause constipation. So that is what is the exception. That's what C is not involved. Piloerection, urinary retention. Acetylcholine stimulates detrusor and enable urination. Adrenergic should cause retention. So urinary retention, piloerection, bronchodilation. That's the reason asthma patients may, if cholinergic stimulation is there, bronchoconstriction, and hence we give ipratropium, which is anticholinergic, ipratropium bromide, which is like atropine. And we give epinephrine to relieve the acute bronchospasm, because epinephrine is adrenergic, which lead to bronchodilation is what you have to basically remember. Then what is a cell wall synthesis inhibitor? Now you got now a question to a antibiotic mechanism 30 years, 50 years, only two drugs are 30 years. What are they? Aminoglycosides and tetracyclines. पूरा चीज 50 years पे चले जाता है. This is much cheaper question than that. Cephalosporin, vancomycin, penicillin, वो cell wall synthesis inhibitor, अगर वो चीज भी मालूम नहीं है तो पीजीआई चंडीगढ़ के गेट्स के अंदर भी नहीं आने देते. तो बेसिक क्वेश्चन, वेरी बेसिक क्वेश्चन. What are antagonistic combination of the drugs basically? So if you take penicillin and combine it with any of this, erythromycin or chloramphenicol or tetracycline, this we don't expect all to know. This is not an essential MCQ. Okay, if you read, then only you will know it. But at least now you know it, no? Tomorrow when it comes, you should remember. Penicillin plus tetracycline, chloramphenicol and erythromycin. Then what is synergistic? Enterococcal endocarditis is there, for example. Any endocarditis, what will you give? You will give cell wall synthesis inhibitor like penicillin. अगर एंटेरोकॉकल के वजह से एंडोकार्डिटिस हो गया तो खाली पेनिसिलिन देने से काम नहीं होगा, उसके साथ ही साथ आप एक एमिनोग्लाइकोसाइड भी देना पड़ता. दोनों को मिला के देना पड़ता है. So penicillin plus ampicillin plus streptomycin or gentamicin like an aminoglycoside is additive, is what you have to basically remember. What is meant by KD? KD is that concentration of the drug at which half of the maximal response is seen is called KD, just like Michaeli constant in case of enzyme kinetics. Now, what antibodies are there on O blood group? Another very fundamental nursing question. Group A, Group B, AB, O. What antigen will be there? A के ऊपर A antigen, B के ऊपर B antigen, AB के ऊपर AB and O के ऊपर none. Antigen. Opposite is with antibody. A के ऊपर anti B, B के ऊपर anti A. When AB are there on AB, antigens are there, antibodies will be none. Whereas group O, antigens will be none but antibodies will be anti A and anti B. That's the reason O is called as universal donor. And AB is called universal recipient, because they don't form antibodies on to anybody. किसी का ब्लड दे दो ये हमारा ही है बोलेगा, because it won't form antibodies to any type of blood you transfused. Hence it is a universal recipient, is what you have to basically remember. Then what is mandatory to screen in a blood bank? HIV, hepatitis B, hepatitis C. Another very easy question. Which vaccines are prepared from embryonated eggs? So basically influenza, yellow fever and rabies. You have to be careful if the person is having egg allergy for you to administer. Right? Whereas hepatitis A and CMV are not like that. Hepatitis A is grown in human diploid cell culture. And अगर CMV के बारे में बात करें तो there is no vaccine available, is what you have to basically remember. Can the online students can punch whether the voice is loud and clear? I'm a little scared to look at the chat window, but I am hoping that there should not be any technical difficulty on your end. Can you please punch? Yeah, clear. Shweta says clear, Shah says clear, Ram says clear. Very good. Gas gangrene. There is a passive immunization available. What is active immunization? What is passive immunization, doctor? Active means that brings immunological memory. That can be achieved either by giving live vaccine or killed vaccine. Anything will immunologically activate the system. But if you give serum or if you give immunoglobulin, then it will only protect immediately. It won't create any immunological memory. That becomes passive immunization. So do you have a serum, anti-serum available to counter the toxic effects of the gas gangrene? Yes sir, they are available. So tetanus, diphtheria, botulinum, snake bite, gas gangrene. In these 4 scenarios we are still using passive immunization, is what you have to basically remember, and passive immunization is an immediate protection that you can basically offer. Now doctor, urine dipstick cannot detect the Benz-Jones protein. It can detect microalbuminemia, RBCs, WBCs, etc., but not Benz-Jones. Benz-Jones कैसे प्रोटीन होता है? अगर हीट करे तो it will become positive, and when you cool it, it will turn negative for the detection. Special feature of the Benz-Jones protein. You can't detect it using dipstick. Coming to phagocytosis, let me tell you doctor, 2 pages you have in microbiology, the forest called Anantanarayanan. 2 pages on immunological disorders, Job syndrome, Wiskott-Aldrich, Chediak-Higashi, IgA deficiency, combined variable deficiency, किस में क्या होता, किसका इनहेरिटेंस क्या होगा, आज रात घर जाके you have to review, and to your surprise you will detect that you have already underlined it long back. Let me honestly tell you, that's the reason what is the best thing to read is your own textbooks which you studied in undergraduation. Already underlining, overlining, everything will be there and some memory will be there. We had a crush on somebody while reading this topic. So once more, while reading back that topic, we will remember that person, we will remember that song. So it is ingrained into our mind, right? So while we were in first year of, while we were reading pathology, inflammation topic, I still remember Geetanjali was a movie that was released long ago. So every time Geetanjali song comes, first thing is not the song I remember inflammation chapter, right? So that way our mind memory system is, that's the reason we will be afraid to have the classmates meeting after some years, because you will start remembering a lot of different topics when you look at your own classmates after 15-20 years. So phagocytosis, what is accept about it? So basically, Dr. Jobs, Chediak, Higashi, myeloperoxidase, tupsin, they are all basically phagocytic disorders. Similarly, you have lazy leukocyte syndrome, hyper IgE syndrome. Recently a question was asked, Schwann-Diamond syndrome belongs to what type of disorder? It is a disorder of phagocytosis, Zipmer-May, I think. Some recent review we had. So definitely questions will come once more. Very high yield topic. What is used for sterilization of surgical instrument? Ethylene oxide, glutaraldehyde, hot air oven. They are all the things. So similarly for disposable syringes, glasswares, metal instruments, thermometers, there is a big supermarket list available for you to have a look at least once. Sorry, there is one more slide, don't forget. Then H influenza. It is also called 5 years bacillus. It is the capsulated strains which are often isolated. And what is the importance of VP test? VP is Vaux-Proskauer's reaction. There is a bigger reaction called IMVIC, IMVIC. So it is Vaux-Proskauer negative. There are very few organisms which are Vaux-Proskauer positive. What are they? Enterobacter, Klebsiella, Serratia, Vibrio and Hafnia. They are the only ones which are VP positive. And also you have VP negative organisms like Shigella, Salmonella. What are all these? They are all basically gram-negative organisms. They are divided into VP positive, VP negative. That's the point. So once more a question can come from this list of VP, Vaux-Proskauer's reaction. It is not easily stainable. H influenza is what need to be remembered. And it is an immotile bacillus. And examiner asked on simple thing like, is it motile or not? Have you heard any flagellate type of motility? Kuch bhi nahi hai na? So it is non-motile. But they don't go around reading all organisms whether they are motile or not. Just because H influenza was asked. H influenza they can ask because in the microbiology list given to you, top 20 topics mein aapko H influenza hota, 5th topic or 6th topic. So you should. Then what is used to decontaminate the sputum of in smear preparation? We use N-acetyl cysteine sodium hydroxide, which will improve the detection of Mycobacterium tuberculosis. Heterophile agglutination. What are all the reactions where it is basically used? So, Wheel Felix, you have got Wheel Felix, Paul Bunnell, cold agglutination test and Streptococcus MG agglutination test. These are the 4 tests you need to remember which are used for heterophile tests. Heterophile antibody tests is what you need to basically remember. How can you bring active immunity? You can give a toxoid, you can get a subclinical infection, or you can expose to antigen. But if you give immunoglobulin or an antitoxin, it will only give passive immunity without any immunological memory, is a very, very fundamental question. Once more a question on passive immunity. It can very much be transferred. If you give serum, anti-serum, then you can transfer the antibodies even before the disease occurs. For example, rabies bite happened. It is a class 4 bite. Only giving rabies vaccination means you need to wait for immunity to start. But if you also give serum, you are giving immediate protection. So that is the reason it can be given before disease occurrence. Then what mediates anaphylaxis? 5-hydroxytryptamine, heparin, prostaglandin, anaphylatoxins are there in the complement system. Platelet activating factor also is called anaphylaxis mediating substance. Coming to the enterovirus, it is stable at a pH of 4. That is the reason it is able to survive in our gut. If it is unstable, it won't survive in the gut, no, common sense. Padne se aayega nahi, ye option B. Then pleurodynia, it can cause. One of the types of enteroviruses are what? Coxsackie A, Coxsackie B, ecovirus, they all come under the super group called enterovirus.com. So that's the reason it can cause encephalitis, meningitis, pleurodynia, etc., etc. It is an RNA virus, but it is not a segmented RNA genome. It is not a segmented RNA genome. But what type of RNA virus it is called? Positive sense single-stranded RNA viruses. So naturally, examiner's favorite question is going to be, what are positive sense single-strand RNA, negative sense single-stranded RNA, and what are the segmented RNA viruses, and what are the DNA viruses? वो पूरा lineage पढ़ना ही पड़ेगा आज रात घर जाने के बाद. Then coming to the dengue fever, there are 4 serotypes which are available. Then it presents with fever and joint pain, as all of you know. It belongs to flavivirus. Then there is no effective vaccine available, and it is not a segmented RNA virus. So what are the segmented RNA viruses? चलो वो बात खत्म करेंगे. Bora, Bunya, Orthomyxo, Rio, Erina. Some method. You need to remember. Bora? That itself is boron. Oh, you can remember Bora. You have Tora Bora. Tora Bora is Hawaiian Islands. Which one? Bora Bora or Tora Bora? Tora Bora. So after getting MD seat, you will marry, you will go with the dream girl or a dream boy to honeymoon. So all that planning must be ready, only reading is not enough. So Tora Bora Islands, you can go for a honeymoon. What are those caves where Osama bin Laden has gone into? They are not Tora Bora, no. Because I will be giving you a wrong place to go for honeymoon. What hills, mountains they are? Arey, oh, mere dimag mein nahi aa rahe. He went and hidden in some mountains. They are called. But I think Tora Bora is a vacation spot, I think. Anyway, you remember Bora. So for the segmented RNA virus. A stool examination was showing darting motility. Yeah. Darting motility. Which one it is in the stool? Vibrio cholera and Campylobacter jejuni. So that gives you a list. Tumbling motility, Listeria, stately, like a king is walking. list Clostridia and Bacillus, corkscrew, Treponema pallidum, lashing, like tongue lashing, Borrelia, gliding, Mycoplasma, swarming will be Proteus mirabilis, darting will be Vibrio and Campylobacter. So, Tora Bora is locally as Spin Ghat is a complex in the White Mountains of eastern Afghanistan. Oh, sorry, that is not a honeymoon spot then. Huh? So, good review from Anu has saved us from not going for a wrong spot for honeymoon. So, Vibrio alginolyticus, what is true? It is called halophilic Vibrio. It is not non-halophilic. And this is BP positive. Oakes Proskauer reaction positive. It is swarming in nature. It causes ear infections, sea-borne auricular infections. And it is the one which grows in sea, means it should grow in sodium chloride. So, it grows in 10% NaCl is what you need to basically remember. And it is a gram-negative marine bacterium, which is not a cause of epidemic encephalitis. Herpes simplex and rabies are not epidemic encephalitis, they lead to sporadic encephalitis. That's the idea. If a dog bites only, you get no rabies. Will entire community get rabies epidemically? Unless that many dogs are there. Then HSV also is most common cause of sporadic viral encephalitis. But if you take arboviruses, alpha virus, flavivirus, St. Louis, etc., they lead to epidemic encephalitis is what you need to remember. Coming to visceral leishmaniasis, it will affect bone marrow. That's the reason neutropenia will be there. And whenever fulminant immunity is down, our humoral immunity will step up. And hence polyclonal hypergammaglobulinemia will be there whenever you have visceral leishmaniasis, which is true. And it leads to hepatosplenomegaly but not lymphadenopathy. And it leads to skin hyperpigmentation. And what does that pigmentation contain? Melanin predominantly. So that's what you need to basically remember. Then doctor, regarding the antibody, I think easiest question on the planet. IgG protects the body fluids, Ganga hota hai fluid. IgA protects the body surfaces like GIT respiration. IgM protects the bloodstream. IgE is reagenic hypersensitivity. IgD is on the surface of the B lymphocyte is what you have to basically remember. Then there are various types of treponema which you need to remember. Yours is also called Frambasia tropica, and it is a tropical infection of the skin, bones and joints. And Treponema pallidum pertinue is the one which is basically associated. And it is transmitted by using fomites instead of a sexual transmission. Unlike its cousin, Treponema pallidum comes only with an intense sexual activity. This will come even by sharing the cup, saucer, bed, I mean only bed without anything else, and the clothes. So fomites. Begel is what? Is a question. Treponema pallidum endemicum. Pinta means Treponema pallidum caretium. And syphilis is Treponema pallidum pallidum. Right? So that is what you need to basically remember. Then, coming to the various bacterial toxins, how do they act? Botulinum inhibits acetylcholine release, which is true. Shiga act by inhibiting the protein synthesis, and diphtheria act by inhibiting the protein synthesis. They are all the true statements. How will cholera toxin will act? Adenylate cyclase and cyclic AMP, as all of you know very well. Once more, what is the high yield topic in examiners? One toxin के बिना microbiology का 6 questions खत्म नहीं होगा. One toxin will definitely come in the exam. So what toxins inhibit protein synthesis is a very high yield topic. Shigella, diphtheria, Pseudomonas, and the verocytotoxin are the ones which basically inhibit the protein synthesis is what you have to basically remember. Then coming to adipocyte. Adipocyte lead to offensive smell. Yes, because it is a fat saponification. Dalda gives smell, no, which is nauseating smell compared to the sweet, wonderful smell of ghee. So offensive smell. If you have buried body in a moist soil, saponification occurs and adipocyte will form. And if there is a widespread adipocyte, then it becomes dry and ultimately you will get the London May, what is a wax model? All top people will become wax. You too can become wax model provided you are buried in a wet soil, moist soil. Then what are the various names for the post-mortem? What is that called? Tussaud's, Madame Tussaud's gallery. Not bad. For a few more years I can continue teaching without early dementia. So, but sorry for the Tora Bora. Don't go by my suggestion. Go to Tirupati, T for Tirupati and B for Bhuvaneshwar, Puri. They are all good places. Post-mortem color change, the dependent parts of the body. What do you call? You also call lividity, livor mortis, suggulations, vibices, etc. etc. Where do you see abrasion collar? A gun wala question जरूर आएगा, bullet के जैसे answer करना है आप. तो firearm entry wound में two things are characteristic. One is called abrasion collar surrounds the duct collar. These two are characteristic of the entrance firearm wound. One stain, semen stain, blood stain, salivary secretion stain or some CSF stain. So if you look at spectrophotoscopic test, then it is having very high sensitivity. Even 1:5,000 dilution also it can detect, is what you have to basically remember. Now comes the sleep promoting medicine. What are the 4 strains of HPV, doctor? Gardasil, Cervarix are the 2 types of vaccines. Both will have protection against HPV 16 and 18, and Gardasil also will protect against HPV 6 and 11 also. And Gardasil is basically what? Quadrivalent, containing all the 4. Millennium development goals are enunciated until 2015. So till next year, still chance is there of getting this MCQ. ये थोड़ा लंबा स्टोरी है. इसमें पूरा 12 are there. Proportion of population below national poverty line को half करो, and people who suffer from hunger उसको half करो, and those who are remaining like a vagabonds without PG seat also make them half karo. So that is the plan. How you do half is not important. You can increase number of medical colleges and decrease the number of postgraduate students. That is different. Means is not important. Objective is important. So all these are there, doctor. You just review it. I leave the literature for you. Outbreak of avian influenza epidemic in China 2013. ये तो 2013 PGI May पेपर है ना, इसलिए don't remember it. अभी क्या वायरस चल रहा है? इबोला चल रहा है. तो नेक्स्ट PGI में आएगा इबोला. अभी क्या चल रहा है? JNC 8 क्राइटेरिया इन हाइपरटेंशन, वो गाइडलाइंस पढ़ो. फिर भी फॉर जनरल नॉलेज H7N9 is what you need to remember. And don't use this knowledge and answer. अच्छा 2030 में H7N9 means 2015 में H9N11 it should become. No, it won't be like that. So now case control versus cohort. From times immemorial, this is a favorite question. Case control, you will use it for rare disorders. Case control, you will do it in hospital, so you will be biased and error will be very high. And case control, you can use, it's a retrospective study. उनके पूरा जन्मदिन से, इस जन्मदिन से जब वो जन्म लिया तब तक आप पीछे जा रहे. is not only one factor. Did he smoke? Did he drink? Did he drink and smoke? All the multiple factors you can study as to why he got the cancer today. So there is a reason it can study multiple potential causes of the disease, not the single factor. Is the specialty of case control. Expert MTB RIF is basically a cartridge based, like a printer, automatic diagnostic test which can identify Mycobacterium tuberculosis DNA, and also it can identify any rifampicin resistant. And what technique will it use? Not a technique, that is nucleic acid amplification technique is what it will basically use, is what you have to basically remember. Shailaja and Mukhtar are asking what is the question for 91, question number 91. 91 answer is H7N9. That's what you need to basically remember. Good. Then doctor, women empowerment के अंदर क्या क्या शामिल किया गया? Women should feel sense of self-worth. Does not mean men should start feeling worthless, right? Don't translate into antonyms of that. The right to have and to determine choices in counseling. That's the reason women reservation in MD General Medicine. Counseling. First girls choose, then boys choose, whatever left over. And all girls will choose general medicine, and what will be left over will be diploma gynecology for boys. Because of the women empowerment. And the right to access opportunities and resources. And the right to have power to control their own lives, in addition to controlling the men's life. And their ability to influence the direction of the social change, to create a more social and economic order. You are all in future going to become top consultants. You will be owning a hospital, and all your staff will be waiting for you to address on Jan 26th. You must be ready with these facts and figures also. Bhashan dene ke liye. Now doctor, drinking water quality, what are the recommendations of WHO? pH of 6.5 to 8.5, chloride of 200 to 600, and turbidity should be less than 5 NTU. And how much should be the color is the question. Color is up to 15 true color units, not more than 15 true color units is the water standard, is what you have to basically remember. Multibacillary leprosy बोलने के लिए दो तरह से बोल सकते हैं, क्लिनिकली बोल सकते हैं, दूसरा माइक्रोस्कोप देख के बोल सकते हैं. Clinically, if there are more than 6 skin lesions, then it become MBC, less than 5 become paucibacillary. And any skin smear positivity, it can be 1 plus 2 plus 3 plus, any skin smear positivity defines it as multibacillary leprosy, is what you have to ultimately remember. Now one calculation based question nahi hai to mathematics in PG medical. So how do you calculate, doctor? You have been given the total population, and you had been given the number of deaths which has happened and birth which has happened. A simple calculation is number of live births by mid-year population multiplied by 1000, and that become 40 by 3000 into 1000, that becomes 13.33. And don't worry about who are immigrating, how many are immigrating, all those do not matter. That's the point. And a city has a population of 10,000, beautiful question. 500 are diabetic, and a new test, true positives are found to be 350 and false positives are found to be 1900. Then what is true regarding this test is a very, very important question. Yeah. I told you now. पॉजिटिव प्रेडिक्टिव एक्यूरेसी, नेगेटिव प्रेडिक्टिव एक्यूरेसी के ऊपर जरूर एक क्वेश्चन आएगा. And if examiner gives who are true positives, true negatives, false negatives, good, like this. But sometimes they will give sensitivity specificity. You must know the formula. I already gave you that formula. Okay, chalo, let's start the game. A are true positives, B are false positives, A plus B is all positives. C are false negatives, D are true negatives, and C plus D is all negatives. That if you go horizontally. But what is A plus C? All deceased. B plus D is all not deceased. Now let us start. In this given question, all deceased was given. What is the number? 500. And all deceased include true positives and also false negatives. A plus C is given as 500. Right? Then he said around 350 are truly having diabetes, true positives. So A ka value 350 hai. Right? Then then what else did he give? False positives were given, that is 1900 was given. And already what is false negatives? 500 minus 350 will give you 150, because A plus C was 500, A is 350, C should be 150. What is the only challenge in this? We require D. If you know the D, then you can calculate specificity. Sensitivity के लिए D का जरूरत भी नहीं है, खाली A और A plus C मालूम हो गया तो फटाफट खत्म कर सकते. But for specificity was asked, so D is required. Right? Now, how will you calculate D? So basically, where does D come? B plus D is all the people who are not deceased. Already you know B. From that you can get the D. How? All not deceased are B plus D. Already you know B, which are 1900 plus D. And how do you get all who are not deceased? You take all total population minus all deceased was given to you. If you subtract it, you get all who are not deceased, and that includes B plus D. So 10,000 total population minus 500 who are all deceased. If you subtract, you got 9,500. So 1900 plus D is 9,500. Hence D is 9,500 minus 1900, that becomes 7,600. Now using that, you can calculate everything. Sensitivity is A by A plus C, 350 by 500. You get 70%. Specificity क्या होता है? Specificity होता है D by D plus B. Already you are having D as what? 7,600 divided by D plus B is 9,500 into 100 is 80%. And you can also calculate prevalence. Prevalence means what? All cases who are 500 divided by total population, which is 10,000, which will give you 5%. Okay, doctor? So यही क्वेश्चन आएगा नेक्स्ट एग्जाम में आएगा. अगर पीजीआई लास्ट 10 years 10 पेपर्स करे तो सेम कॉन्सेप्ट के ऊपर 7-8 टाइम्स आता. देन यू विल टेल, अरे इसके लिए इतना पढ़ना, इतना कोचिंग का जरूरत है क्या? That is the reason what you require is only that high yield topic list, wherein you are having what topics are so repeatedly asked out of the big list of topics in the textbook. Just revise those pages in textbook, more than enough. Now coming to tuberculin test. Those who have sarcoidosis will be typically tuberculin negative. They show energy. Then TB pericarditis will show positive test. Miliary TB can show negative test, and it is used to know the prevalence, tuberculin. But will you use the tuberculin test to diagnose pulmonary TB? No, you cannot. अगर भारत में पैदा हुए, बेगम बाजार में स्कूटर चलाए, उस्मानिया मेडिकल कॉलेज को गए, you will be tuberculin positive. Because we are surrounded by TB bacillus, we are all exposed to that, and tuberculin positivity is not an uncommon finding, is what you need to basically appreciate.